Well, hello, it's Mark here from Newcastle Hypnotherapy, and today we're talking about anxiety disorders. I'm answering your questions that we've had lately about anxiety and anxiety disorders, so it gives you an idea of what anxiety is and how you can put it right, where you can go for help and what you can do to free yourself from anxiety, depending on what you want to do. So, first of all, I want to thank you all for your questions. We get lots of questions coming in. We do lots of these little lives. And we've also got a YouTube channel full of information as well. So please keep that information coming in because it helps us to answer your questions. And we do enjoy doing that anyway. So if you've got any more questions, by all means, leave a comment when you go live on the system. You can leave comments on YouTube and we'll get back to you and answer those the best that we can. So first of all, there's lots of different types of anxiety. Depending who you go to for help, there's lots of people who will give you different names for your anxiety. So the big one is generalized anxiety disorder. There's also social anxiety. There's panic attacks, the post-traumatic stress disorder. There's OCD. There's phobias. There's lots of different types of names for anxiety. And again, depending who you go to, they'll give it totally different titles. And for somebody like me as a specialist, it helps a little bit, but I prefer to do my own questions and answers to find out exactly what it is. So what is anxiety? The big question is, what is it? Some people say it's a chemical imbalance in the brain. Some people say it's a lack of certain drugs or lack of certain nutrients. To me, it's not. It's a mental pattern that we practice in our head. If you imagine when we worry, we think about something in the future that probably isn't going to happen. Well, that's a type of anxiety. So it's a mental pattern that we practice, and it can come from a whole lot of sources. The NHS is very good at looking at why we've got anxiety, and to a degree that's useful. But for me, I like to spend more time sort of putting it right. So we can get anxiety from people around us. We can pattern what other people are doing, and that can makes us anxious. It's natural to copy what other people are doing around us. So if most of your friends and your family are anxious, it's going to make it worse. We can also get it from events. Now, we do go through our lives and we have nice things happen and we have not so nice things happen. But sometimes trauma, sometimes a big event, can put us into that fight or flight state. That's exactly what it is. We get into that fight or flight state and we stay there. And the more that we rehearse it, the stronger it becomes. And for some people, it's very different. For some people, they get up in the morning and the anxiety is present. For other people, it'll just suddenly come on and they'll have a panic attack. There's lots of different ways that anxiety shows itself. So some of the symptoms are that we can be feeling nervous. We can be feeling restless, tense, agitated. We can have feelings in our stomach. We can have tingling in our toes and our fingers. Our breathing can be sort of hyperventilating. We can have high blood pressure, palpitations, stress, sweating, trembling. There's loads of different ways. Energy is a big thing with anxiety. Lots of people lose the energy levels, or it fluctuates up and down. Focus and concentration can be a problem. We can just feel nervous all the time and constantly just worrying about all the things that are happening or could be happening. And it can make life really, really difficult some ways. Now, a big part of what we do is we look at the digestive system, and we find that quite often when there's anxiety, the digestive system's not working properly. We don't absorb enough nutrients. It means that our immune system isn't working properly, and it just causes problem after problem after problem. So it's important to put anxiety right as quickly as we can, because long term it does have a big effect on our health. Although anxiety is not healthy, it affects other parts of the body. As I mentioned, the digestive system isn't working. We quite often put on weight or we lose weight. The immune system's not working properly. And especially in this day and age, we need to make sure we're as healthy as possible to handle everything that's going on in life. So there's 3 different ways that we can get help with anxiety. And the first one's the most common one in the UK, is that people go to their doctor or their GP. And it's a good protocol because it's worth just figuring out what's going on. It's worth asking them to do a blood check, because sometimes if we don't have the right nutrients in our body, this can make anxiety an awful lot worse. We know that food, diet, and lifestyle is a major thing with anxiety, but push your doctor to get a full blood test done, because quite often they don't like to do it. So go and see your GP, and usually when you see a GP, they do a couple of things. One is they'll push you to take some sort of medication, and there's pros and cons with that. We know with all medications, there are side effects. And a lot of the clients that come to us don't want to take drugs for that sort of reason. They'd rather sort out why they've got anxiety and they'd like to put it right. The other side of it is they can send you off to counseling or something called CBT. And usually counseling and CBT, they don't get you free of anxiety. They help you to cope with it, how to live with it. And I don't necessarily agree with that. It helps, it can help. But to me, you should work to get rid of the anxiety rather than just cope with it and live with it. But that has to be your choice to do that. The second route that a lot of people go down is self-help. There are thousands of books now on Amazon, loads of hours of video on YouTube about how you can self-help yourself. There's some really good techniques. There's some good books out there. And a lot of people find it helps if you've got very low or mild anxiety. The third step is that you come to see somebody like me, a specialist anxiety, who does this work all the time. And the difference is, first of all, we can usually sort it out an awful lot quicker. We'll look at an awful lot of areas that the doctor won't do, but it just helps you to learn to, first of all, reduce the anxiety and take it way, way down. And the way that any specialist will do that is they'll have a proven system. They will have been trained in a program or a system that helps you to deal with that anxiety. And they will take you through that step by step. And although you can buy some programs out there, it's a full package of how to do it yourself, everybody I find, every single anxiety client that comes to see me is slightly different. They've had a different set of traumatic experiences in their life. Their diet is different. They've got different lifestyles. And the whole point is that we coach and help people to go through it step by step. We hold your hand to support you in the week. There's a number of sessions. And we also look at what's happening in the gut. We get a food sensitivity and allergy test done. And this all really helps people, is that once we get the gut sorted and we get the mental health sorted, we look at your lifestyle, your self-care, we find the clients move an awful lot quicker through the process. And typically in 4 to 6 weeks, they get it sorted out. So it's a much faster process than going to your doctor and waiting months and months for counseling and medication and seeing which meds work and which ones don't. Self-help's very good because that's how I did it. When I had anxiety problems as a child, I started picking up lots and lots of books and learning what worked and what doesn't. Sorry. However, the big thing is it's having a specialist there to help you. So the options are there. There's 3 options. There's your GP, there's self-help, and there's finding a specialist. And different options help different people. For more self-help stuff, if you look on our YouTube channel, we've got a lot of tips and techniques if you subscribe to it, which will help you to get through all of this an awful lot faster. So it's up to you what you do. I hope I've answered your questions there, and I do hope that you get your anxiety sorted. As somebody who's been through it, I know how miserable it can make life. It kind of ruins everything else. And yes, it's linked to depression, it's linked to stress, and there's all sorts of problems. So I hope you get it sorted out. So thank you for your questions. Please, by all means, keep your questions coming. If you'd like to consider working with me privately, get in touch. There'll be a link below where you can have a free chat with us on the phone called a phone strategy session, and we can just look at your anxiety and see how that is affecting you and what would be the best way forward. And again, feel free to comment, leave us a comment with your questions. Make sure you share this with your friends, and I hope you enjoy the rest of your day. Take care.